population. Altogether, data from all over the world indicate that the prevalence of diabetes in patients affected with COVID-19 is not higher than that observed in the general population, especially if considering that most of the existing reports are from hospitalized patients and hence may suffer from a selection bias that may result in increased prevalence of diabetes by excluding less severe non-hospitalized patients. Thus, data suggests that diabetes is not a risk factor for COVID-19 infection, and although diabetes does not seem to increase the risk of COVID-19 occurring, diabetes does occur more frequently in patients with severe COVID-19 infection. However, patients with diabetes who develop COVID-19 has been seen to have a worse prognosis and increased mortality in most of the studies. In a meta-analysis of 9 studies from China involving 1,900 patients, showed a significant correlation between the severity of COVID-19 and diabetes, with odds ratio of 2.7. In 200 Chinese patients, the risk of developing acute respiratory distress syndrome by the presence of diabetes will increase up to twofold. In a Chinese retrospective study, patients with diabetes had more severe pneumonia, higher concentration of liver enzymes, fewer lymphocytes, and a high neutrophil count. In another meta-analysis of 6 Chinese studies, the prevalence of including 1,500 patients with COVID-19 in Wuhan, those with diabetes were more likely to require admission to an intensive care unit or die. What about mortality rate? Case fatality rate was 7.3 in patients with diabetes, as opposed to only 2.3 in those without diabetes, in a report of 44,000 patients of COVID-19 patients reported by the Chinese Center for Disease Control. And in a recent study in 1,100 patients with COVID-19 from 88 centers across the USA, diabetes was associated with more than 4-fold increase in mortality. A British cohort of 5,000 patients with COVID-19 in hospital showed also that the risk of death was 2-fold higher in those with diabetes, especially those with uncontrolled PM. And finally, a survey done in England showed that among 20,000 patients with COVID-19 dying in hospital, those with type 2 and type 1 had 2 times and 3.5 times respectively chance of dying compared to the 2 patients without diabetes. That is in addition to a very long list of studies that showed the association between diabetes and more severe COVID-19 infection, more ICU admission, more need for mechanical ventilation, and of course, higher mortality rate. So the data clearly indicate that although diabetes is not a risk for COVID-19 infection, it is a risk for disease progression towards critical illness, development of ARDS, need for mechanical ventilation and ICU admission, and ultimately death. Why patients with diabetes have increased severity and mortality? Individuals with diabetes have increased susceptibility to infection due to defects in immunity, namely inappropriate T cells and reduced natural killer activity, especially with hyperglycemia. And they have also delayed or blunted antiviral interferon gamma response. And interferon gamma response is known to inhibit viral replication within infected cells. And all these defects could reduce viral clearance and increase the severity to COVID-19 infection. Furthermore, the coexistence of diabetes and obesity, or what we call it diabesity, is characterized by procoagulant state driven by decrease in the production of nitric oxide, which is the powerful vasodilator and platelet anti-aggregatory agents by endothelial dysfunction. Presence of high levels of